Exercise is Medicine is a global initiative by the American College of Sports Medicine, and the local chapter is called Exercise is Medicine Singapore. Its main objective is to train healthcare and fitness professionals to confidently prescribe exercise to patients. The overall goals of Exercise is Medicine is firstly to raise awareness amongst doctors and other healthcare professionals to monitor the exercise levels of their patients, and secondly to train doctors and allied health professionals to confidently prescribe exercise to their patients. Thirdly, to train fitness professionals to carry out the exercise prescription and supervise the patients in those exercise programs. Right. And finally, to raise the awareness amongst the public to let them know that if they need an exercise prescription, be it for general health reasons or for their medical problems, they can go to a doctor or fitness professionals to get an exercise prescription. As for the components of the exercise prescription, we use a FITT Pro model, as in FITT progression. F is for the frequency of the exercise, whether it's exercising 3 days a week or 5 days a week. I is the intensity of the exercise, that is the heart rate or the exertion level of the exercise. T is for the type of exercise, for example, the cardiovascular exercise, strength training, flexibility training. And if it's cardiovascular exercise, is it brisk walking or jogging, or is it swimming, or is it cycling, or is it badminton, etc. The last T stands for the time, as in the duration of the exercise, whether you're exercising for 15 minutes per session or 60 minutes per session. And finally, the progression of the exercise, as in how fast we step up the exercise. For exercise prescriptions, we tend to customize it for each individual person. But in general, there are 3 must-haves. You must have cardiovascular training, flexibility training, and resistance training. For the cardiovascular training, try to accumulate 150 minutes of moderate intensity physical activity or 75 minutes of high intensity physical activity. For the flexibility training, it is also a must, and we recommend that it be done daily. For the resistance training, we recommend that it be done twice a week. And there's a 4th component which is recommended for people over 50 years old, and that is balance training, and that is mainly as a fall prevention strategy. How does physical activity or exercise help in aging? There are 3 aspects to look at. First, we know that aging tends to be accompanied with a decline in functional capacity. Exercise, or regular exercise in particular, helps to arrest or reverse that decline. Secondly, in aging individuals, there is an increased risk of acquiring chronic diseases such as diabetes, high blood pressure, high cholesterol, osteoporosis, etc. Regular exercise reduces the risk of these diseases, and it is also an important intervention in the management of such diseases. Finally, we know that exercise can prolong a person's lifespan, and not only that, it can also improve the remaining quality of life.